Hey, it's Dr. Terry Presley here, and let's talk about recovery after total joint arthroplasty. More specifically, when can you drive, when can you get back to work, and when can you get back to doing the things that you enjoy doing. Now, this is more specifically for total knee arthroplasty. For total hip arthroplasty, the recovery is going to be even faster. So, as far as getting back to driving, I tell my patients you have to be off of narcotics, you have to be able to slam on the brakes in the event you need to do that, and that's typically around the 3 to 4 week mark. Now, getting back to work, it depends on what you do for work, and every patient is different. So this is just a standard guideline. If you work from home, you can go back to work as soon as 3 weeks. If you work at a sit-down desk job that you have to drive in for, usually that's around 4 weeks, as soon as 4 weeks. If you're up on your feet a little bit, that's around 5 weeks. And if you're doing a more physically demanding job, that's 6 weeks plus. Now, getting back to the things you enjoy doing, like any sports activities or recreational activities, I see a lot of golfers. I tell them, pitching and putting, that's around 4 weeks. And then hitting the driving range is usually around 6 weeks. And then getting out onto the course is thereafter when you feel comfortable doing those things. Same with tennis, pickleball, stuff like that. Usually around that 6 week plus mark, getting back into tennis and feeling it out and easing back into the activities that you enjoy doing. Most importantly, staying safe and letting pain and discomfort be your guide. Now, that's a good question to ask your surgeon, is how can you expect your recovery and get back to doing the things you want to do? We'll talk more about your recovery, and until then, we'll talk later.